Hello everybody and welcome to the Norfolk and Suffolk Foundation Trust AGM and annual members meeting. I want to begin with thanks to each and every one of our staff who have worked to deliver compassionate care throughout the global pandemic and who continue to do so as we experience its impacts and as a consequence face an increase in demand and acuity amongst our service users. My thanks also to my council of governors who have continued to meet and indeed increased the frequency of their meetings throughout the pandemic and supported the trust so ably. My thanks in addition to our partners who are increasingly working with us as a whole integrated system, seeking to improve outcomes of care and the way in which we work together. But most of all, I want to thank our service users and carers who work alongside the trust to really ensure we can continuously improve and offer responsive services. I just want to do a little bit of housekeeping so you're aware of the things that we need to do during the meeting. If you look on your screen, there is a speech bubble with a question in it. We've got questions that have been submitted that I'll ask, but throughout the meeting you can add your questions via that speech bubble and we'll pick them up and we'll make sure that we answer them. There's also an ability to access closed captions and there should be a sort of CC icon at the bottom of your screen that you can click onto so you can follow the conversation. And finally, just so that you're aware, the AGM will be recorded and it actually will be available on our website. And we expect to conclude our conversations at 2:30 to help you with your timing, and because it's an hour and a half, we haven't actually put in breaks into today. This is actually my very last AGM as chair of NSFT, and I am truly proud of the improvements that we've made together and the focus, intent and deliverable plans that we have in place to continuously improve and to bridge the gaps where we know we need to have more focus. I'm really pleased that my successor, Zoe Billingham, is with us today, and I'm just going to hand over to Zoe so that she can introduce herself. Zoe.
Hello, hello Marie. Hello everyone. Just to echo all of Marie's thanks and just to say how enormously privileged I feel to be joining the trust and to be hopefully taking forward all of the brilliant work that people have been doing and also Marie's legacy. And I'm very new to this. This is my first meeting, but it's absolutely lovely to be here to say hello and to see you all. And thank you for inviting me, Marie. Back to you.
Thank you, Zoe, and welcome. We're so excited to have you on board and I look forward to working with you during the transition. So just a bit of an overview of today. There's probably two parts of the meeting. The first part where we are really going to be holding to account and reporting back on our previous year, beginning with a report from Stuart, our Chief Executive, and welcome to Stuart as the first AGM as our Chief Executive. We will then be handing over to Howard, who's our lead governor, to present the report of the Council of Governors. And finally, Daryl, our Chief Finance Officer, is going to present our annual reports and annual accounts. We then have a session where we're going to explore our partnerships, and that's going to be led by Catherine Ellis. And at each section, so we'll be asking questions after Daryl's spoken, and then we'll be asking questions again around partnership working after Catherine's spoken too. So I really look forward to hearing the debate. So Stuart, I'm going to hand over to you first of all to present the Chief Executive report.
Thank you very much, Marie, and hello everybody. Good afternoon. I'm just really proud to be here today. This is my first AGM, as Marie has said, as Chief Exec, and very privileged to be able to lead the organisation through the next stage of our transformation journey. We could have the next slide, please. I thought it would be good just to start a reflection on where we are, by just reminding ourselves of the plan that we already have in place. Our mission and our vision, it remains the same. We want to make sure that we can support the people of Norfolk and Suffolk to live the absolute lives that they want to live, their hopes, dreams, aspirations, everything we can do to give them a really well and happy life. And we know that we've got our own vision as well as an organisation. We want to be in the top quarter of mental health trusts for quality and safety by 2023. And we set our plans to achieve that a few years ago now. So we thought halfway through that journey, it would be good just to review the strategic outcomes that we've been working to. And you'll be familiar with this slide, but what we have done is added at the bottom one that's really important. It's about us continuing to focus on improving the access and the quality of care. This has been our utmost priority over the last few years. And as you can see, along with our other outcomes of ensuring that we can inspire, engage our staff, that we can work and to build improvement skills across the organisation, and importantly, the focus of today's AGM, how we work in partnership with our systems and with the people across Norfolk and Suffolk to make sure we can get to achieving the mission and the vision. Can the next slide, please? So it's been a very, very busy year. I'm going to come on to COVID in a few moments, but I just want to reinforce really Marie's comments to thank everybody. It's been a year like no other. It's been 18 months, which none of us would have predicted. And you know, I'm very proud to work with so many colleagues who have gone above and beyond to keep our services open and available to people throughout the pandemic. Many colleagues who have moved out of their family homes, they've been living in hotels during the first and second wave, and they've done absolutely everything possible. People have been great and have been at their best during what has been an incredibly challenging time. We're really pleased with the improvements that we've made, although we're aware we still have a long way to go and have lots to do, lots of exciting ambitions left in us. But we were really pleased in January 2020 to get confirmation from the CQC that our rating had moved to requires improvement. That's a reflection on an enormous amount of hard work that has taken place and commitment from a large number of people, both in NSFT and around us as well, to ensure that the services, the mental health services that we provide are of the highest quality. You'll see from the slide some other highlights for us. We've got nearly 1,000 more staff than we had previously. The money that we have available to us to provide services has increased by a considerable amount, and we've also been able to do some real key projects and schemes which are making a big difference to people. For example, we now have mental health liaison teams in all of our acute hospitals across Norfolk and Suffolk. We've been able to do some really targeted work around our out of area placements, and we've reduced those numbers, and that has been down to a really strong partnership across Norfolk and Suffolk, helping us to achieve that. We've been able to open some additional beds. These are beds that are available for working age adults and also some beds for older people. And one of the key achievements has really been how colleagues were so responsive and set up our first response service very early on in that year to make sure that we had 24/7, 365-day-a-year access for people, recognising that this wasn't just needed for people who had mental health issues and crises, but everybody, the whole population was going through a really difficult time, and we needed to make sure we were there for people. That service continues to do really well, and we're now working in partnership on how we can move that into an NHS 111 option. But as you can see from the slide there, it takes an enormous number of calls. We've also done lots of suicide awareness sessions for staff and also for public, and that's been a particular success over the last 12 months, which really should be commended. One of the other areas that has really been a focus for us is our learning disabilities services across Suffolk, and we've spent £1.3 million on our Walker Close services to make sure they're fit for purpose and that people who stay in their facility can get a really good quality, safe level of care. So that's been very exciting, and that was a wonderful co-produced project, which means that's a really first-class environment. Again, COVID has been a big feature. It's become a bit business as usual for us now, as it has for all of us, but it has really been a true system response to ensure that we can keep all of our service users, but also our friends, colleagues and families safe as well. I think it's a good opportunity as well to recognise our staff COVID support service, which is a service that was set up really very quickly. Diane Palmer, who's our Associate Director of Nursing, and also a number of our colleagues put together a nurse-led service which is available to all NHS staff and social care staff across our system. And we've set that service up in partnership with Mind, and as a service they were very highly commended yesterday in the National Mental Health Awards for the services they provide during the pandemic. So a big shout out to them and a real thank you. I know they've really helped a large number of colleagues through the last 12 months. The next slide, please. So as we've mentioned, today's AGM is about us focusing on the partnerships we've had and the focus that we've had around improving and developing those partnerships. That's very much about us listening to what people are telling us. It's about making sure that anything that we do and our response is very much around how we do that in partnership with people across our two counties. So you can see there we've split this slide into 3 areas. So we've done some significant work, particularly with our colleagues within the organisation, to make sure that we can work together to reduce the average monthly average use of restrictive interventions. And we've also been key players in ensuring that we've been leading on the transformation projects across Norfolk and Suffolk. Most importantly, it's the partnership that we're developing with our service users, our carers and their families and friends. We have more co-produced services. We have a greater understanding of co-production. We are working hard to ensure that everything we do is co-produced with people. And there's a couple of examples there, and we're naming the Helsden New wards and also the Catton ward, where service users are absolutely at the centre of what we're doing, and the intentions that we have are absolutely built on what service users and their carers are telling us they want. As with our partners as well, we've been focusing on a number of areas, and I think it's fair to say the key area for us over the last 12 months has been around access to our services, particularly for children and young people. And there's been some really good working, recognising that system partnerships and partnerships with the social care and the voluntary sector is key to ensuring we get people to the right place at the right time for their care, treatment and support. The next slide, please. Okay, so I think that's everything from me. If we look forward, though, briefly before we hand back to Marie on the next 6 months, we're going to be building really on all of the areas that we've highlighted as being successes for the past year. We're really focusing now on how we embed our roles within the new integrated care systems and the regional collaboratives, making sure that the voice of people with a mental health and a learning disability are at the centre of all the discussions made around the way that services and systems are transforming. We're also making sure that for the next 6 months that we continue to listen to people and we continue to sustain the changes that we've made. And we're going to have a real key focus, particularly on our community mental health teams, who are going through a fantastic period of transformation with significant additional funding being made available to them. But we're conscious as we go into the winter months, we need to make sure we can keep our service users and patients safe at home, and we need to support our community teams to do that. The focus of that will be very much us continuing our mantra of ensuring that we are good, high quality and safe in our service delivery, but also that we're person-centred and that we're making sure that we're really listening to people and we're really understanding what people want from us. So we've got an exciting 6 months ahead of us, building on a successful but challenging previous year, but really excited about what we're going to all achieve together. So I'll hand back to you, Marie.
Thank you, Stuart. That was a really good reflection on our past year. And before I hand over to Howard, who's going to give the report of the Council of Governors, I just wanted to draw everyone's attention to the chat, you know, the little speech mark with question mark where we've placed the minutes from the previous meeting. And after Daryl has spoken in terms of the accounts and the annual report, I'll be coming back and asking people to confirm the minutes of the last meeting. So Howard, really pleased to hand over to you so you can talk about all the work the Council of Governors have been involved in. Howard.
Hi everybody, lovely to see you here today. The photo proves that actually I only do have one jacket. Let me introduce myself. My name's Howard Hidman. I am a member of staff here at NSFT. I'm the carers lead at Great Yarmouth and Waveney. And I'm one of the staff governors and been elected by the Council of Governors to be the lead governor. Can I start by kind of reiterating what Stuart and Marie have been saying? The past 19 months has been frightening for many. However, our staff and volunteers have approached these months with courage, determination and dedication to continue to provide and indeed improve the care we give to our service users and carers. Our staff and volunteers have faced sacrifice and indeed many of us have lost friends and family. But that determination and continued dedication, I must thank you on behalf of the Council of Governors, our members and the public we serve. So if we look at that slide, as mentioned, despite the difficult circumstances, we've managed to increase our engagement with members, sending out 16 newsletters over the past 12 months and we've had improved engagement with these newsletters. I would like to thank Lucinda, our membership secretary, for her hard work, and I must give my apologies for missing her laughter yoga session. For those who know me, they will appreciate laughing first thing in the morning might be a step too far for myself. Our annual plan events have allowed members to shape our governor priorities, which have helped shape the trust strategy, but also increased and improved our relationship with our third sector colleagues. I'm particularly pleased we've increased our number of partner governors and thank them for giving up their time. Next slide, please. These priorities have focused the Governor's activities for the past few months and months coming forward, and indeed at our next performance meeting in November we'll be focusing on the experience our carers received, and this is going to involve Governors speaking to various carers, including 2 groups of young carers, and also speaking to the carers leads, enabling them to sort of triangulate how the experience our unpaid carers are receiving. And that would come under quality improvement defined by service user experience. If I could have the next slide, please. Supporting improvement. The governors have spent much time listening to others and challenging the board from what we have heard to help support improvement, including hearing from service users, carers and our care groups and staff. One of the consequences of this is it's now mandatory for staff to have training on autism and learning disabilities. The governors continue to ask for change at pace, especially around children's, families and young people's waiting lists and eating disorder services. Sadly, the pandemic has seen some of our gains in this area slowed. Indeed, COVID-19 has continued and continues to shape much of our work. I'm particularly proud of how we've helped to improve staff wellbeing this past year. The governors are passionate that the service users, carers' voice and members' voice are heard at a system and national level. As a consequence, we held a national conference for governors at the beginning of the year to hear thoughts and feedback into the government's white paper on integrated care. The importance of your voice needing to be heard continues with the election of me to the NHS Providers Governors Advisory Committee, and tangible results can be seen in the guidance the government is now giving around to integrated care systems about engagement. The governors continue to be passionate in fighting health inequalities, and dare I borrow a phrase from Boris Johnson and say levelling up healthcare for all. Next slide, please. One of the roles of the governors is to hold to account, and we are holding the non-executive directors to account for the performance of the board, at the Council of Governors and individually at our performance sessions. Our role is to appoint a new chair. We've reappointed 2 non-executive directors and overseen NED and chair appraisals and their objective settings. We've approved the CEO appointment and we've received the annual report and accounts. We've helped shape the people participation strategy to hold the organisation to account for effective co-production and engagement, and we've been attending ICS partnership board meetings in public, influencing systems and helping to address health inequalities. Next slide, please. Governance during COVID-19. I believe the governors and NSFT have ensured that we are one of the best examples in the country in continuing the work. the governors, being swift and nimble to introduce new meetings and systems so governors can participate, including the provision of electronic devices to ensure no governor was digitally excluded and all voices could be heard. And I must give many thanks to Jean, our company secretary, and Nikki, who works for her, and the rest of her team to help facilitate the effectiveness of the Council of Governors during this difficult period. Next slide, please. This coming year, we will be launching our new membership strategy to engage more active members, supporting more public events, focus on our new priorities to hold to account, encouraging more people participation in co-production, and working with our new CEO and chair to help the Trust deliver on its refresh strategy, and continuing to help those without digital technology to participate. But at this point, I must give a big thank you to our outgoing chair, Marie Gabriel. She has helped us through these very difficult times, but has helped us steadily improve along with the rest of the board. The council is looking forward to working with our new Chief Executive Officer, Stuart, who we are excited to be working with, and is going to be an excellent CEO. We are particularly excited to begin working with Zoe, our new chair, and are delighted she has joined us today. Next slide, please. So, the important bit. We are currently going through the governor election cycle, and we need new governors to help join us to hold the board to account and ask challenging questions. So we are looking for service users from both Norfolk and Suffolk to apply to become governors. We're after a carer governor from Suffolk, and we're after two public governors from Norfolk and Suffolk. I'm sorry, that slide is slightly wrong. And you must join us at 3 o'clock for the exciting event today to turn around and learn all about what it is to be a governor. So we really look forward to you joining us, but please do consider becoming one of our governors. I'm sure the board would welcome and love you to turn around and join the Council of Governors. I believe that's it from me. It's been a real pleasure talking to you, and once again a big thank you to absolutely everybody, staff, board, service users, carers. It's been a very difficult year, but we're there. Thank you.
Thank you very much. Thank you so much, Howard. Thank you for your kind words. And I would add to his encouragement to become a governor as a real opportunity to influence the Trust strategy and decisions. So please do consider that. I'm really pleased now to introduce Daryl Chapman, who is our Chief Finance Officer, who's going to present our annual accounts and our annual report. At the end, we will be approving those along with the minutes of the meeting. Daryl, over to you.
Thank you, Marie, and it's a pleasure to be here. And for those of you that know me, that photo does prove that I do smile occasionally, but it was taken a long time ago. So if you go on to the next page, please, Kushani. So we are required to receive the annual report and accounts for the year ending 31st of March 2021. Rather than turning page by page on the 120 odd pages of the document, the full document is available via a link in the chat. What I will try and do is pull out some of the highlights and via the use of two emoticons make it much more interesting. So just the headlines. We had a requirement to deliver a break-even plan. What we actually reported in the annual accounts is a deficit of 0.9 million, but our actual reported position to NHSEI was a 0.9 million surplus, so we achieved our plan. The reason for the difference, without getting into too much technicality, is just around some of the vagaries of NHS reporting and the fact that we had an impairment on some of our property values during the course of the year, and that reduced those down. Oh, Prashani, could we just go back one or two? Keep going. Stop. Thank you. Also worth saying that our cash balance at the end of the year was healthy at just under £36 million. And capital expenditure, so unusual for a finance person, there's a frowny face next to our capital expenditure. So we didn't spend all of the money that was available to us. And we'll talk about this more on a future slide, but it's worth pointing out the whole of the NHS had challenges in the last year around delivering capital. As we all know, there was multiple lockdowns during the course of the year, and access to contractors and materials was very difficult. Most of the schemes that we didn't manage to complete in the year have been completed subsequently in this year, but we will go into a bit of detail about what we did spend our money on of that £9 million. Thank you, Krishani. Just to show a brief summary of where our nearly £290 million comes from. As you'd expect, nearly 80% of that comes from our clinical commissioning groups within Suffolk and Norfolk. The next biggest chunk is around NHS England, so that's for our specialist services, so secure services, mother and baby unit, and our perinatal services in our tier 4 CAMs. So there's big numbers there, but as you'd expect, most of that is healthcare and comes from our healthcare areas. Just one thing to point out: non-clinical income has jumped up for anyone who's eagle-eyed. That's because additional funding from NHS England to support us through the pandemic had to be allocated against there. So there's an 8 million jump in that number, and it's purely because of that. Next slide, please. And then where do we spend that money? As we all know, the staff are the lifeblood of our services, and nearly 3/4 of our expenditure is on our staff. Next biggest cost there is the big pink section, 13.8% or 40 million of other costs, which is predominantly around our premises costs. So this is making sure we've got our properties maintained, rental of properties from third parties, and general supplies. One thing I want to pull out in terms of it's relevant to what Stuart said in his introduction, and also to what Catherine will be talking about later, is we have an element on there which is still quite a thin sliver at the moment, but purchase of healthcare from other bodies of 12.5 million. That's a 27% increase on what we did in the previous year, and this is where we are investing and commissioning services from our partners. So we're talking about VCSC, voluntary sector, charities, etc. As we all know, the value of those services is immeasurable, and what we've seen in this financial year is actually a considerable increase in the funding that we deliver to them. So while it may be actually quite a small number for us, that increase in funding is significant for our partners, and we will look to continue to do that in future years. Thank you, Krishani. And now we've just got a brief summary of that capital investment I talked about earlier on, just to pull out some of the areas where we've been spending it. As you'd expect, one of the main areas is improvements to clinical areas. So that includes improving aircon in a lot of areas for our staff and for our service users, looking at therapy rooms, continual anti-ligature work as new methods and technology comes along, refurbishment of 80 St Stephen's, one of our clinical bases in the middle of Norwich, lots of work on improving bathrooms, furniture. So really across all of our estate, making sure that it's fit for purpose. One of the things that Stuart talked about and we're really proud of is completing the work on Walker Close. For those of you again who are eagle-eyed, you'll notice the number here is different to what Stuart mentioned. Stuart was talking about the total investment. It spanned 2 years, so we've just got the 1.1 million for Walker Close. And those photos at the bottom are the work that was completed on Walker Close to really freshen it up and bring it out. Although the second one, and apologies because the little footnote is wrong, the second one is actually our music room in Foxhall House down in Ipswich, where our service users are able to produce and generate fantastic music as part of their therapeutic interventions. Also, we had considerable investment in digital, as you'd expect. A big chunk of this £1 million was funded from the Department of Health and Social Care. And a lot of this was allow us to continue our staff working during the pandemic and working from home. We have the first kind of spend, the first tranche of spend on the Helston New Ward. So this is creating the development and the work that we talked about earlier in terms of engagement with all of our stakeholders. Really happy to say we've installed energy efficient lighting across our whole estate, and that's quite an achievement to complete. We're talking tens of thousands of installations, so fantastic work there by our estates department. And then a little bit of spend on COVID response, and this is around making sure we had segregation and facilities for our staff to be able to wash up at the end of their shifts and not have to go home in the clothes they've been using throughout their shifts. On to the next slide, please, Krishani. Thank you. It seems a little bit strange talking about financial challenges in the year when if ever there was a year when finance was at the bottom of the agenda, this was it. And I'm glad to say that the government and Department of Health and Social Care really did step up in terms of funding us and all NHS organisations to make sure there was adequate funding to allow us to continue our services. So just to pull out some highlights. So we got an additional 7.8 million for COVID funding to cover the cost of us having to continue delivering our services during COVID. We also got nearly £8 million of top-up funding, which is to make sure we just had the cash and the money to do whatever was needed to make sure we continue to deliver our services. We also got nearly £2 million of support for annual leave, and while this was welcome, of course we'd have liked our staff to be able to take annual leave, but within the reality of the pandemic, we know that that wasn't possible. So a lot of annual leave was carried over into this year. I'm really happy to say that that leave is being taken, and we're starting to see that accrual go down, which is really positive. It's really valuable that our staff have the time to relax and get away from work. Clearly, the financial challenge wasn't our challenge for last year. It's about the focus on service delivery, and everything was done to continue that. And I'm glad that we put processes in place that made frontline staff being able to access funding to be able to make sure their services continue was absolutely our priority. And clearly we spent money on PPE, which was making sure we kept our staff and our service users safe on our wards and when visiting our clinical facilities. And I touched on it already, but I'll say it again, the ability to spend capital was constrained by the fact we just could not get anyone to come in and do the works. And that was seen across the whole of the NHS, unfortunately. Let me just go on to the final slide, Krishani. Thank you. Clearly challenges for this year, so 2021, 22 and beyond. Most of these will be obvious. So staff availability. This isn't just about dealing with people having to isolate and having to stay at home while they're unfortunately dealing with COVID themselves. It's also about the fact we need to catch up with developing our staff. Our staff have been flat out for the last 18 months. We need to give them the time to recharge their batteries, to get their development up to date, make sure they continue to professionally develop themselves and get their training up to date. You know, we've been doing everything we can to keep those services safe, and now we need to try and catch up. So staff availability is going to be a real challenge. Obviously, safe environments is critical to everything we do, and that continues throughout COVID and the constraints we have around the use of our buildings. We're all aware of the fact that there's an increase in demand for our services, particularly we've seen in children and young people. So how we manage that demand to make sure we're working as productively as possible to make sure we can see as many people as possible. Service recovery is about our service recovery, so trying to get back to some sort of normal, but also supporting our system partners to allow them to get back to normal. Clearly, we'll have continued delays around trying to develop our capital plans. And as we've all felt, or at least heard, the restrictions and the increases in materials costs does place some challenges on us around some of our estates work. And then we have the NHS financial framework, which has been moving around for the last 2 years, rightly so, to make sure we've got the funding to support our services, but we don't know yet what that's going to look like for future years. And then a couple of bullets there, just around further reductions in external placement. So that's obviously a service priority, but also gives us some financial opportunities. And we are dealing with transformation on a massive scale. So particularly around our children and young people services and the work we're doing with our primary care network colleagues, we are trying to keep our services safe, maintain business as usual while developing the transformation and the new service that we'll be delivering in the future. And then finally, those of you that have been near any of our sites would have seen these lovely thank you rainbow signs that we've had, and this is a personal statement from me. I just want to thank all of our people, not just our staff, but all of our people who've helped us deliver the services over the last 18 months. So this is our staff, this is our partners, this is those people who deliver services on our wards to keep them clean and make sure that our service users are fed. So from the bottom of my heart, which I'd love to think was rainbow coloured like that, thank you very much. And now over to Marie. Thank you.
Thank you very much, Darryl, and I echo those thanks. So before we go to question and answers, I need to formally ask the meeting to receive the annual report and the accounts and to agree the minutes. So that's a difficult thing to do virtually because I can't see everybody. But I would just ask that the meeting do that. If anyone's got any concerns or any questions about that receiving of those reports and minutes, please could you raise your hands now? Or put it in the chat. Okay, I haven't received any comments or seen any raised hands, so I take that as approved and received. Thank you very much. I'm now going to turn to some questions. A couple are quite straightforward. There's one about the PowerPoints from this meeting, and I can confirm that we will make sure that they are available on our website, so you'll be able to access those, and it will probably can put those up before we actually put up the recording, so we'll make sure that those are available. And we've also put in the chat details of the session after this meeting for people who are interested in becoming a governor. I'm going to turn first of all to some submitted questions that we've had before the AGM, and we've actually got quite a number about carers. But before I do that, I'd like to ask a question of Dr. Daniel Dalton regarding from one of our service users, and that's Lynn Marie. So what Lynn Marie is asking is, why are no service users that are taken to hospital tested for any deficiencies or toxicities, both of which are vital for mental health well-being? And asking us, why do we medicate people's trauma and call it chemical genetic brain imbalance? And she goes on to describe her own journeys and of being medicated and how she became more ill, and doesn't view this as healthcare, and actually how she has found a different way to cope with her condition, and how she's done that without medicine, and that's made her stable for 7 years, although that's not the expectation nationally of somebody with her condition. So I thought, Dan, if I could hand over to you to respond to that question, that would be great. Dan.
Thank you, Marie, and yes, thank you for the opportunity to respond. I'm sorry to hear that there's been some difficult times for Lynn Marie, but I'm glad that her last 7 years have been good, so that's really good to hear. We do expect people to be screened for common deficiencies in their physical health when they come to see us, but there are some more unusual things which we would only do if there was a need for it. So common things like common vitamin deficiencies are part of the routine screening that people should have, as well as other routine blood tests. In terms of medication, for some people it's a really important part of staying well that they have medication to treat their illness, but for everyone it's important that we make sure that their psychological needs, their social circumstances and all the things in the outside world are also part of the way that we help them. So it's great that for some people, after a single episode of being unwell, they don't need to take medication for a long time, but for a vast number of people it's really important not to stop medication suddenly. So it's super important that if someone is taking medication and they would like to withdraw that, do that in consultation with your team, speak with your doctor and your nurse, and make sure that the support is there to do that safely and well.
Thank you very much, Dan. I've now got a couple of questions relating to our reference to carers in the annual report, and I'm going to call on Sophie. Sophie Bagg is our head of people participation, which is a term we give to the way in which we work with service users and carers. So Sophie, I'm going to do them in sort of one at a time because they're both a little bit detailed. So the first one is the annual report has approximately 15 mentions of how carers can be or are involved in giving feedback and co-production and co-design of NSFT services. What issues are being raised by carers? How are their concerns being taken forward? And what impact has their participation had on improving the quality of services? Oh, sorry, Sophie's not on the panel, it's Diane. I think it's Diane who's going to answer that. So over to you, Diane.
Thank you, Marie. So listening and working with carers is just so important because we know that they are integral to service users' recovery. So picking up the issues that have been raised from carers, there's a variety of issues, but sharing and providing information is one, listening to issues and concerns, and feeling that people are not always part of the service users' care. And there's an issue around clear and timely communication. All of those issues are fed back to the care group and part of our improvement work. It's important to note that during this period, we've continued with our quality and safety reviews, and we've listened and spoken to over 250 carers, and their feedback has been absolutely invaluable. And it's really helped drive some of our quality improvement projects. We've also got carers involved in training, involved in the Helston new build work, and in 2 QI projects as well. Thank you.
Thank you. And the second question, and you're probably going to get a few more, but I'm doing the long ones first. Is again in relating to the annual report, and the report mentions 8 risks that could affect carers, from COVID to waiting times. You've highlighted the risks of not listening to carers. So the question specifically is, how is NSFT ensuring staff in all its services communicate meaningfully with informal carers of people with mental health problems, especially when the person they support is too agitated or confused to describe their current problems or follow medical advice without day-to-day support?
Thank you, Marie. So we're doing lots of work around how do we support carers, how do we engage with carers. So carers awareness is part of all of our preceptorship packages. It's part of all of our development programs, and it's going to be part of our induction as well. We're really lucky that we've got some dedicated and designated carers leads and carers champions, but we need to build on that as well. But we really want every single person to be thinking about carers, not to just be leaving it to our really, really talented carers leads. And that's why we're trying to make it part of absolutely all of our learning. We are also we're also doing some specific projects. So in our inpatient services, we're trialling out a project where the matron makes contact with the carer within 72 hours. We're having carers leads involved in early learning reviews, and we're thinking of lots and lots of different ways to really raise the profile and hear the voices. Thank you, Marie.
Thank you, Diane. I was just turning on my mic. So the next 2 questions I'll ask together. One is regarding the People Participation Committee and how it has oversight of the care strategy. They would like to have an access to a copy of the care strategy. So where can they find that? And the second person is asking what data does the board have to evidence the work being done with carers? Would the board consider setting a KPI around identifying carers? Over to you, Diane.
Thank you. I'll take the last one first. So we're really lucky that Jill Curtis, one of our carers leads, is developing a carers quality dashboard, and I think that will be really, really helpful for us. Around the issue of KPI, I'm not sure if we need a KPI. We just need to be really clear about the standards and the expectations, and we can then see if we're delivering that via the dashboard. That would be my view, but happy to have a discussion around it. In terms of the People Participation Committee, the strategy states that we will have a carers manifesto, carers, I can't remember the word of it, but it's not a carer strategy. It's looking at some partnership working, but I can send that out to people.
Brilliant. It might be useful to have a link on the website. Might be easier than others can access. That'd be quite useful because we're putting up a few bits of information for people after the AGM. So we'll make sure that's on the there's a link to that work on the website. I'm just going through the questions that I have. Right, I've done that. There's a question on what is the Trust response to Department of Health's publication regarding advice to GPs and hospitals regarding doctors overprescribing of medications, not checking side effects or drug interactions. So I'm going to come to you, Dan, about that, about our response to the DOH publication about overprescribing by GPs and hospital doctors.
Yeah, thanks. Thank you, Maria. It's a really welcome report, and we know that one of our priorities as an organisation for the last 2 years has been improving medications management, and medications management is all about making sure people get the right medication at the right time, but also that's done in the right way, which means not over prescribing medications. And one of our priorities that we've been working with our GP colleagues and colleagues in other parts of the health system has been about not over prescribing medications. And it's important to say that over prescribing isn't the same as prescribing full stop. I mean, some medications are really effective and very important, but we also know that there is a big problem, particularly in some of our coastal communities, with the use of dependence forming medications. The good news is that we know that there are some fantastic examples of how we can help to tackle that, but we can only do that together. So some brilliant work's been done in Yarmouth and Waveney, for example, which has involved working in partnership with all the people who prescribe medications, not just in one service or another. So it has to be that everyone comes together in this, but most importantly, bringing our service users and their families on board as well. So a really important part of this is that it's a partnership effort where we have to make sure that we look together at how people can have the right medication, and where they don't need medication, that we find a way to help them to understand that and work with us to do something to improve quality of life. And I think the last thing I'd say on that is that we know that often people turn to medication because there are other things they need that they can't get access to. So that's things like social support, good activities and meaningful life experiences, and psychological therapies. And we're absolutely committed that we need to work as an organisation and with others to build those things so that medication isn't the place people have to turn to. And this report is a fantastic platform for us to start that, Marie.
Thank you very much, Dan. The next question from JML is asking us about who are the moderators. And I think we have moderators today who are just technical people who are helping to sort of highlight the questions that come in. But you may be asking about our regulators, and we're regulated both by the Care Quality Commission and also by NHS England and Improvement. And there's also a question related to that about, given the corporate nature of the trust, how they fit in with a good day to publish bad news. I just want to be really clear. I believe that there's not a good day to publish bad news. I think what we as a trust seek to do is to be open and transparent about when things go wrong, and actually work with a range of people, including services and carers and families, but also our regulators, to understand why things went wrong, to learn from that, and therefore improve from that. I hope that answers that question for you. The next, I don't know if anyone else wants to say anything, I just think I've answered that one. The second question from the same person asking, are there plans for a special general meeting once we're cleared of restrictions? I think this is a really good point, actually, because we're not able to meet and see each other face to face and have interactions, and everybody's missed that, actually, and we've been quite concerned about the isolation for many of the people that we serve and actually work with. So I think that's a good idea, and I'll pick that up with Jean, who's our board secretary, trust secretary, and also with Howard as our lead governor, because we are thinking about how, when things are safe, do we actually have our meetings in public again, and maybe we could actually organise a special meeting to really have a conversation with our members, given that we've not able to do an in-face meeting. So this is a way in which we are having to operate at the moment virtually and be transparent, but there will be an opportunity for us, again, I'm sure, to meet face to face. The next question is regarding our perinatal team, and asking, can anyone, I see Stuart's hand gone up, can anyone give the perinatal team an update on their issue rebase, which remains on the risk register? The team have not had a premises since it was set up 4 years ago. Stuart.
Thank you, Marie. Thank you for the question. So yes, we have had some difficulties finding a permanent base in the right part of the county for the perinatal team, and apologies for that. That was slightly delayed as well by the different way of working, and us realising going forward that we needed a mix of a base and also a mix of people working from home. So I can say that I'm aware of the team having an away day next Tuesday. And I think I'm coming along as well, and some other managers as well, and I've been told there's an update on Tuesday about where a permanent base could be, so that there'll be more information on Tuesday.
Thank you, Stuart. There's a question, and I think this is looking at the initials, and it might be the original question that we had around medication and the brains, and the question is, given the research into brain changes in those holding long-term positions of authority that tends towards the psychopathic with a continued decline in the empathetic, and what are the trust plans to rotate staff into other positions? Therefore, what training is in place? I don't know who wants to. Dan, do you want to try have a go at that? Thank you.
I can, and I think the first thing to say is that it's an enormous privilege to have a leadership role like this, and I think we have to keep reminding ourselves that it's an honour to be here rather than a right, and that humility is incredibly important to us to maintain our empathy and compassion. But it is really important that we also think about developing our leaders for the future. We've got fantastic emerging clinical leaders within the organisation, and I think often they find themselves, Marie, in positions where they're required to take incredibly challenging decisions, and that can become overwhelming. So I'm really pleased that over the course of the last year, we've been able to develop a leadership programme for our clinical leaders, and they've been doing that in partnership with our organisational development team, and it's a programme which enables them to learn the skills for the craft of the role, to think about how they connect with each other and reflect, maintain their connection with reality, and also have those sort of self-aware, reflective, supportive conversations with coaches and others. And I know that similar programs are in place for our developing clinicians across the organisation. But the more we can do of that, I think the more we'll be able to maintain that compassionate and critically important empathic service that we have at the moment.
Thank you very much, Dan. Stuart, I think the question from Beatrice might be best answered by you regarding a commitment from your predecessor to have James Wild, one of our MPs, to visit Sunfire Ward, and of course the pandemic's meant that we've had additional restrictions, so visits have not always been easy. So the question from Beatrice is asking, when is NSFT going to resume hosting MP visits? And the second bit to this, which is about, I got told earlier that relations with MPs had been paused. I can assure you, and I'm sure Stuart's going to explain, that we've continued a dialogue with our MPs in different ways. So the visits and our relationships with MPs, Stuart, over to you.
Yeah. Thank you, and thank you, Beatrice, for your question. We're starting to plan visits again now. As Maria's just said, we've maintained contact with our MPs from across both counties throughout the pandemic, and myself, I've been meeting with them as well as part of my induction into my new role. So a number of visits have already been arranged, so we'll be in contact with James's office to rearrange the visit that was postponed because of COVID. So we're getting back to normal. We're doing it in a safe way, but obviously we want to have as much conversation with our local MPs as possible.
Thank you, Stuart. I think the next question is for you as well, from Noah, and Noah's asking about, really happy to see the progress to requires improvement, but that's welcome to hear. But what does the trust feel it still needs to do to achieve a good rating, Stuart?
Thank you, Noah. Yes, it is good news, but you're right. Our goal is to be better and continuing to get better, and our plans to get to good focus very much on ensuring that the support that we offer people is really person-centred, is very personalised, and that is delivered in a format for people that is really accessible to them. So it's about ensuring that we continue to make sure that the changes we made are embedded fully and consistently throughout the organisation, that we continue to listen to people to make sure that any developments we have are really person-centred, but also to get to good, we also need to make sure that we're looking after our colleagues as well, and we've got really good support packages for our colleagues, that we've got good supervision, good appraisal, lots of the things that people need around them to make sure that they keep themselves safe and well and can look after our service users safely. So we've got some good plans in our improvement journey to get us to good, and it's very much about continuing focused as we are, quality and safety, but also ensuring that we can truly embed everything that we've done in the past.
Thank you very much, Stuart. The next question I think is probably best answered maybe by Diane. Can you update on the number of peer support workers you have now compared to last year's AGM figures?
Thank you, Marie. I don't have the exact number, but we can get it and get that out to people. But what I can say is we really, really value our peer support workers and our participation workers. The difference they make is you just can't measure it, but I will get the numbers for you.
Thank you very much, Diane, and we'll publish that on the website, the AGM website, so that people can access that information. And the final question I can see in the chat is asking whether there is a drug-free strategy for managing severe mental illness in the pipeline. And the person asked the question talks about their own experience and how they've been drug dependent for a number of years for trauma, and they've asked their GP and the CGL to support them to reduce and to learn to live drug free, but they feel that this individual's mental health isn't stable enough yet. So I just thought it feels there's a catch-22 in there for them, and asking are there drug-free treatment plans in the pipeline? Dan.
Thanks, Marie, and forgive me if my sound is a bit unclear, if you can't hear me correctly, or if my understanding of the question is confused. So the first thing to say is that it's really important that people should be able to access treatment even when they have drug dependency issues, and we are working closely with both sets of our system partners to make sure that we don't turn people away just because they're addicted to drugs. That dependence is something for which we need to provide support in partnership with organisations like CGL, and I think that's something that we've made some real steps forward. The other thing to say is that psychological therapy for psychosis is a really important part of what people need, and we participate annually in an audit led by the Royal College of Psychiatrists that looks at whether we're reliably providing CBT for psychosis, which is an evidence-based form of therapy, and other therapies like art therapies and so on, and they all really matter. And in 3 out of our 4 early intervention services, we have the highest possible rating for provision of that. So it's absolutely something we offer at the moment. The other thing to say is that trauma-informed therapy ought to be, or trauma-informed care, in fact, ought to be the maxim by which we operate in all places. And that involves not just providing psychological therapy, but also being able to see through the impact of trauma to the needs people have. And also to provide support which is mindful of that trauma. So I think all of those things are critically important. If I've misunderstood the question, and it's about treatment for psychosis which doesn't involve prescribed medications, and I'm very happy to respond to that, and please approach me with any other questions about it, Marie.
Okay, thank you. I think the individual was also speaking about their own experience of not being able to access this, the trauma therapy that they need, but I think you covered that in your response. Thank you very much for those questions. We have an opportunity to ask questions again about partnership working after our next session, but I'm going to move us on now to the partnership working and that session, and that's going to be led by Catherine Ellis. So over to you, Catherine.
Thanks, Marie. Thank you so much. Hi, everyone. So I'm Catherine. I'm the Director of Strategy and Partnerships at the Trust. I've joined the Trust about 5 months or so ago, having started off my career in forensic services in Norfolk and Waveney about 20 years ago. So it's echoing what Dan said, I think a privilege to be back working in the organisation. So next slide, please. So we've heard quite a lot already today about the value of partnership working and how that fits into so much of what we do. And as we've talked about, that's about working with individuals, with staff, service users and carers, with our governors. But importantly, and then the focus of this presentation and the video you'll hear is about working with other organisations to best support our local communities and their wider mental health and wellbeing. And this has been and continues to be a consistent part of one of our strategic objectives for the organisation. As we've heard from Stuart and Howard, this is an important part of our trust strategy, hence we're talking about it today. We heard earlier about the guidance and the evolving context that we're working in terms of each of our integrated care systems in Norfolk and Suffolk. And critically, there's a really clear expectation that integrated care systems work and support partnership working with mental health and a whole range of other providers. And we know, looking at the evidence base, that mental health and wellbeing is about so much more than just service provision, although that's a really important part of it. It's about housing support, it's about support for people's income and livelihoods. There's so many factors that are critical to mental health and wellbeing. So hence why it's really important for us to build, maintain and grow the relationships that we have across each of our ICSs. And there's something that's really important, and some of the questions that we've heard from the chat, I think, is about how we foster and build genuine and equal partnership. How do we make this meaningful? How do we ensure that this is shown in everything that we do? And that's about partnership, not just with NHS organisations, but the voluntary sector, with borough and district councils, and a whole range of multi-agency partners that help us together support people in the communities. And just sort of echoing that final point at the bottom of the slide, this is about us building on how we think about how we approach working, how we approach co-production, and how we approach partnering together. So next slide, please, Krishani. Thank you. So we just wanted to reflect on some of the work that's been underway in the trust and with partners over the last year or so, and you'll hear more in the video, some fantastic examples from clinicians, from service users and carers about the positive impact that they've felt and seen by working together. So just a few highlights to pull out, and this is a work in progress. There's absolutely more we want to focus on. So system leadership and collaboration. One of the things that has felt really important to us is that we play a leadership role working alongside colleagues in each of our integrated care systems in helping the thinking and building what we do together around mental health and wellbeing. So we chair and co-chair a number of groups that play a key role in that. So in Norfolk and Waveney, we have a joint transformation board that's co-chaired with the County Council. We also, Marie chairs the Health Inequalities Board in Norfolk and Waveney, recognising that tackling the inequalities that we've seen, and we've seen sadly them worsen through COVID, is really important to how we work. And also then how we approach transformation work that's planned both in Norfolk and in Suffolk. So there's some particular work we're doing with the Suffolk Mental Health Alliance at the moment around improving services across a whole range of ages, children, young people, community services, services for adults in crisis. And a really important part of this will be about engagement with voluntary sector partners. There was a great session that we had a week or so ago with, I think, over 60-70 VCSE partners there, really trying to look together about how can we deliver a more integrated offer in those areas. We'll hear a little bit in the video about the new primary care network mental health workers roles that are being recruited to, and these roles will play such a critical part of supporting us to work alongside general practice in providing a strengthened service offer in primary care. And finally, there's been some work this year around what we call provider and place or Reliance Collaboration. So that's people coming together, providers of service coming together to work and offer something that's kind of integrated, and at times it can be also around geographies or place alliances. We've had the East of England Provider Collaborative, which is a group of 6 NHS trusts across the East of England, go live with a service offer around children and young people, eating disorders, and also forensic and learning disability services. And we're already seeing, I mean, early days, but we're already beginning to see some really positive aspects of working together across the 6 organisations, particularly around clinical leadership and clinical support. So next slide, please. Thank you. I've talked a little bit about the work that we're doing with voluntary community sector partners. Darryl mentioned earlier the importance of us thinking about and building the investment and the collaboration that we're doing with the sector, and I see that only continuing, and I'm really passionate about that. Part of that is about internal work that we're doing to share and make connections between staff and the voluntary sector, and we continue to do work. Naomi and Andrew in our organisation have done some fantastic work to help strengthen those connections and just raise awareness of the whole range of voluntary sector organisations that are out there, and also to continue support and working alongside some key networks like the Suffolk Voluntary and Statutory Partnership, the VASP, which we co-fund with partners from CCG and County Council, which again have played a really critical role in supporting people at locality and Suffolk-wide level to strengthen that voluntary sector collaboration. I will just say something about raising the profile of mental health and wellbeing. So one of the things that we've heard from our staff through our annual staff survey has been how important it is that as a trust we do all we can to promote and raise awareness with other partners of mental health and wellbeing. And we have seen, and Darryl's talked about, significant additional investment coming into mental health services, which we obviously welcome. My one bullet point won't do justice to the work that happens in the trust around people participation, but it felt remiss of me not to mention that, that's such a critical part of working in partnership, as we've heard. And then I think moving on to next year, national thinking, guidance, and doing the right thing tells us that collaboration and partnership should only continue and build. And I think we will see more examples of collaborating with the voluntary sector, more in and around places in which we work, and more, I hope, in terms of growth of the regional collaborative around specialist mental health services. So the next slide, I think we'll now move on to the video. I'd like to thank, huge thanks to those people that have been involved in sharing their stories, and I hope you'll feel inspired as I did listening to them.
Supporting people's mental health needs many organisations to work together. Working in partnership across health, social care and the voluntary sector means that together we can better support the mental and emotional well-being of communities in Norfolk and Suffolk. In today's film, you will hear more from colleagues in primary care, in West Suffolk Hospital, and a patient who volunteers for Get Me Out of the Four Walls about the benefits of working together in partnership. Primary care is seeing a steady increase in patients presenting to general practice who need support with their emotional health and well-being. And this is only likely to increase in line with what we've seen through COVID. In this example, we will hear about mental health practitioners who are based in general practice and who provide a vital support to GP colleagues in better supporting those with mental health and wellbeing needs.
I was one of the first primary care mental health nurses in post as Walton was the pilot site. But since the beginning of this year, there are primary care mental health practitioners covering most GP practices within Norfolk and all the primary care networks.
Having a mental health worker working alongside our GP team has helped the patients that we see in a number of ways. They tend to have more time with our patients. Us as GPs tend to have quite a long list of patients to get through. Sometimes those consultations could be 10 minutes, and even if it is mental health, we tend to, struggle to be able to give them more than the 10 minutes time.
I offer 40-minute appointments. One thing I've found from working in the GP practice is that people have really valued the amount of time that I can give someone. Another benefit to patients coming to see me in the GP practice is it's local, it's familiar, it's an environment that people have usually visited before, so that puts people at ease in itself.
Liaison Services at acute hospitals play a vital role in supporting individuals who present with both general and mental health needs. We work in partnership with acute hospitals across Norfolk and Suffolk in offering liaison services, but in this clip you'll hear particularly from colleagues at West Suffolk in how they work together to support our local community.
Our service back in October last year got funding to go to the full Call 24 model, which is a 24/7 psych liaison service. So that means that anybody can attend the hospital at any time of day or night and have a mental health assessment.
The benefits of having a psychiatric liaison team 24/7 is they will see people within an hour, so the response is really quick. We're also getting a lot of referrals from the ward for people that are depressed or anxious, are displaying behaviour that's challenging, or the ward staff need advice on.
Culturally, within society, everyone knows they can attend A&E at any time of night or day and that they will be seen by somebody, whereas that isn't the case sort of in GP surgeries, or if you attended like where the mental health secondary care teams are based, it doesn't guarantee that someone will be available to see you. It is also helpful if that anybody does have any sort of physical health need as well, so whether if that's that they have harmed themselves or whether they've actually got a condition that they're not managing very well because possibly of their mental health, so when they come into the hospital they can then have their physical health and their mental health looked after as one.
The West Suffolk location has helped the teams because we're all on site together, so it's about building the relationships, having that visibility and being one team together to meet the patient's needs.
The COVID pandemic has shown us just what a vital role colleagues from the voluntary sector can play in working together with us to support the needs of our local communities. In this clip, you'll hear from Charlotte and Kelly and their experience of the benefits of working together in partnership.
Being an ambassador for Get Me Out of the Four Walls gave me the opportunity to give something back to mums and dads through my own journey of becoming a mum.
Most of those organisations that we work with are born out of people who have struggled to find the support they need in a time of crisis, and so most of the staff that we work with are passionate about what they do. I think people forget the voluntary sector, and I think the last year has proved that they play an integral part of support in Norfolk and Suffolk. They're offering peer support, social meets for mothers on discharge or whilst they're in the mother and baby unit. It's offering that continuity so that they can start building those connections in the community. It's something sort of concrete that they've got.
Charlotte has been a patient within the community team as well as the MBU, and what's been really nice is that she has now become an ambassador, so sort of for me talking about my experience and how that sort of helped me has empowered her to become an ambassador and help other mums as well.
I was first admitted to the mother and baby unit in April 2020 during national lockdown, which made this a lot harder. I didn't realise I was unwell, however this psychologists and doctors taught me about my illness and taught me how to manage my symptoms to live a better life. After I was discharged, I learnt about Get Me Out the Four Walls. I just wanted to be part of it and help others, and I can use my experience to help others, and it's amazing.
I think as a mum, I think in any sort of situation in your community can be either quite overwhelming or quite isolating, so you might have lots of places to go to or none at all, but I think having places to go to, I think it needs to be a safe space in terms of not feeling judged, and when perhaps maybe you're not feeling that at all, it's really important I think to gauge those relationships with people that are going to understand your needs.
when we talk about the VCSE, they, you know, when somebody leaves our care, they're there. When they come into our care, quite often they're there, and during, quite often they're there. So I think they play a really vital role as a holistic approach and continuity, and help with the transitions.
I'm sure you'll agree that the examples that we've heard today really give us a sense of how working in partnership together can better help us support the needs of our local communities. We think this is a vital part of how we need to work going forwards to better support everyone with their mental health and well-being.
Thank you, Catherine. That's a really great film, actually, that really brought to life your presentation. So thank you. We have a number of questions. We've got about sort of 10 minutes to go through these. So in your responses, ask you to be short and sweet. Oops. So the first question I'm trying to find, they sort of suddenly disappeared. I'm sorry about this after me saying be short and sweet. We've managed to put, Krishani said we currently have 28 peer support workers across the trust. Not quite showing how many we had last time, but I'm not sure whether that's an increase, but we'll make sure we'll be able to provide that full information. The question really is about partnership. Is how do we make sure that partnership is not tokenistic and not lip service? That we really are signed up in terms of working in co-production with staff and other partners. So I don't know who best would like to answer that. Do you want to have a go at that, Catherine, or do you want to pick it up, Stuart?
I mean, I'm really happy to kick off. I know certainly Diane or Stuart might want to come in terms of some of the aspects of the question. I mean, I think it's a really good question, and I think it's about how does this feel actually for people? So how do we ensure that when we commit to doing things that we follow through on that? How do we ensure that this feels genuine and a sort of partnership of equals, I think, and that's really critical, whether that's about working with the voluntary sector or working with service users and carers to help inform our thinking and care. And I think, really important that we continue to ask ourselves that question and challenge ourselves about that as we do more. I know Diane might want to say something perhaps around particularly the sort of co-production and engagement.
Diane?
Yeah, so very, very briefly, being tokenistic is, in my mind, worse than not doing it at all. So it's really important that it's real, it's meaningful, it's true, it's authentic, all of those things. And how lucky are we that we have people participation leads who hold us to account. We've got the people participation committee that holds us to account. We've got governors who are challenging and supportive in the same measure. And I think it's about listening, hearing and being prepared to do things differently and improve. And for me, that's what real partnership's about, not playing at it.
Thank you so much, Diane. The next question is regarding the Recovery College and how it's done an amazing job throughout the pandemic by adapting courses to be delivered online. And and I agree with the person who's asking the question. This is a really valuable resource and makes a difference. So the question is, Catherine, how does the Recovery College fit into the board's vision?
Certainly, it was a question that one of our staff members asked, and you'll see in the refreshed version of the trust strategy, we made some direct references to the role of recovery as one of the central things of work that we need to do, and therefore alongside that the work of the Recovery College. I don't know if my clinical colleagues want to add anything to that at all.
There's lots of nods of agreement, so it's essential to our vision, I think, is the response. There's one just saying a thank you, really. Hearing you say that trauma-informed care, Dan, should be the basic makes me so hopeful for the future. So a confirmation of the point that we made. The next question is, and I'm going to come to you, Stuart, because it's about how we engage and support staff. So what is the Trust doing to ensure staff understand the need for good, clear communication with carers, and that we don't, the person asked the question asked, hide behind confidentiality agreements that should not interfere with communication and basic politeness? So.
Thank you, Marie. Thank you. Yeah, a very good question, and quite topical for us at the moment. It's a big conversation that's taking place across the organisation. So we're very clear. It's very important that we involve people's families, carers, friends, whoever is the appropriate person in people's care, and then we make sure that we do that in a partnership approach, that we do that in a way that is meaningful, and that's about us having conversations. It's about giving permission for our staff to do.
Oops.
And it's about us talking about it, but most importantly, it's about us hearing from carers as well of the impact if they're not involved and if they're not included. And again, that's something that has been a big topic for us over the last few weeks. So we're absolutely committed to ensuring that carers are engaged completely in the process of providing care for people. We're aware that we haven't always got that right in the past, but there is a big commitment for us to address that and make sure we fully implement the triangle of care in all of the care that we provide.
Thank you, and supporting our staff to do so. Yeah, brilliant. There's another carer question here about from a carer urgently required accessible respite beds, especially for female service users, and it's required not just for the service users but their families who are left to manage very stressful situations whilst available placements are found. What support do we offer carers whilst in crisis? Diane, are you the best person, or Amy, to answer that?
I can start about the support for carers, but then hand over to Amy about maybe some of the kind of alternatives around respite and alternatives to admission. So if the crisis team, we've got really good crisis teams. They offer support not only to the person in crisis, but to the family, the friends and the carers. Equally, as described earlier, we do have carers leads, and it's how we make the best use of them. But for me, it's talking to the person who is visiting or supporting the person you're caring for and making sure that you obtain that support that you need through that worker, because they're there for everybody. But Amy, you might be able to talk about the alternatives to admission.
Yeah, thank you, Diane. So we're working really closely with system partners because we all acknowledge the fact that there is potentially a gap within our systems to support people as an alternative to admission and offer respite. So we are working with the county councils particularly, who often provide those respite type services, to look at developing that model so that people can receive care in a timely manner. It doesn't require them requiring an acute admission, because I don't think sometimes acute admissions are always what is required. Yeah, that's what we're doing with our system partners. And again, it links into Catherine's presentation, really. Thank you very much.
Thank you. The next question is from Abby, and I'm not quite sure which extra support she's talking about, but I think she makes a good general point. How are you making people aware of this extra support? She's based in a particular area, and she doesn't think anybody in that area is aware that they can access this support service. Catherine, are you able to pick that up?
Yeah, absolutely. Have a go. I think it's a really good question, Abby. I think so. These are new roles, but I think you're absolutely right. We need to think about how we're communicating this with the local community, other staff in partner organisations. So I'm happy to pick up an action with our comms team just to think about whether there's more we can do in that space to promote and raise awareness of the new roles.
Thank you. The next question are there any plans to employ more? And this person works in Norfolk Waverley, sorry, CMHT, and she has really and the person has really proved invaluable in working jointly with some on their caseload, really value the work. And so the question is, will the Trust invest in more training for their own staff to become nurses, and really being a positive way to grow our own staff? So yes, about employment and more staff doing innovative roles. Is that you, Stuart? I should come to.
Yeah, absolutely. And I'll come to Di as well if that's okay. But we're absolutely passionate about ensuring that we can grow our own, that people that were already working with us, they want to move into different areas. And it's not just nursing, it could be other areas. It could be within our corporate services. It could be as a psychologist. There's lots of opportunities. And it's one of the areas that we should have put on our slides earlier, really, Marie, about what progress we've made in relation to offering opportunities for people. But Di, do you want to come in particular about nursing?
Yeah, I do, because I'm really excited about it. So, as you know, we use the apprenticeship levy to its fullest at the moment. So we've got nursing apprentice, nursing associates, assistant practitioners, but we're exploring the OU route, which is very, very exciting. So a 4-year course where people can work and study at the same time. That's ideal for people who maybe haven't had opportunities when they're younger, or maybe people who still need to earn a salary but want to study as well. So we are looking at absolutely everything we can do to create opportunities for the communities we serve, to get people into nursing who maybe haven't been able to get the qualifications to go down the normal university route, but we know they make the best nurses. So lots and lots of things. But you're right, Stuart, you know, this is about increasing peer support workers. It's about increasing AHPs and thinking really creatively and supporting local people. So very exciting stuff.
Whoops, brilliant, thank you. We have a question, a couple of questions actually for JML. One is about our trust policy of keeping couples together in the community when both are service users, and I'm going to do the same the second question, which is around, I think it's relating to what we talked about before. Oh, right, so it's actually not a question, it's just confirming a bit more detail about the questions around brain changes and about actually sort of about how we need to challenge ourselves to think differently. So I think there's two things there, one about keeping couples together when they're both service users, but also how do we challenge ourselves as clinical practitioners, I think is the point that JML is making there. Over to you, Dan.
So I think our vision, our mission is to help people to live their hopes, dreams and aspirations. And I think that means that we want to enable people to have the lives that they want outside of hospital. So we don't see it as our role, I think, to interfere with where people choose to live, who they choose to live with. We want to work with people as partners. That we've said that word a lot, I know, but I mean genuinely alongside people, and to work with our social care colleagues so that people can live wherever is right for them. So no, we don't have a policy about constraining people to live in particular places or not. We want people to have their best lives. In terms of the other comment, I mean, I suppose what I'd offer is the opportunity for JML to catch up with me so that we can talk in more depth, because I think there are some really important points that are being raised, but I can't do them justice here, and I'd love to listen.
Right, brilliant. So I don't know how JML gets in touch with you, but maybe an email to our team and sort of directly, and we can make that connection happen. So thank you. We've got a couple of minutes left, and I just want to use that time for thanks. And I want to thank everybody that was involved in pulling the AGM together. It's not an easy task, coordinating us all and making sure we're in the right place at the right time. So I just really want to thank everybody that was involved in that. And if we were in person, I'll be giving you some flowers. So I just wanted to say thank you and hand you my virtual flowers. I want to thank the audience for their questions and answers, really thought-provoking questions, and enable us to think, you know, we really need to do some more work about with carers. We really need to be thinking about how we challenge ourselves as clinicians, and actually how do we communicate all this change and build on what we do well. For example, the Recovery College. My final thanks are to my incredible board of directors, both executive and non-executive directors. They are an amazing team of people who hold service users and carers and the improvement of our services, but also the improvement of the opportunities for people to live those happier, healthier lives that Dan was talking about, and to live their hopes, dreams and aspirations. So I just think my board have been absolutely incredible, and I just really want to sincerely thank them for the support they've given me over the it's almost 3 years now. They have been individually and collectively incredible. So just want to thank you, and we'll end on that. Thanks everybody for coming, and hopefully next time it will be in person. I will be at the next AGM. Just thought I'd let you know that, Zoe. Okay everyone, take care. Have a nice afternoon. Bye bye.